Millennium Physician Group's Medicare Connect program conquers the confusion of choosing the right Medicare coverage for you. Be confident in your Medicare choices. Millennium's Medicare Connect gets you started in the right direction. Connect with us today at Medicare Connect at mpgus.com. That's Medicare Connect at mpgus.com.
I'm Michelle McCormick. Our conversation today is all about health insurance, what you need to know about making the best decisions for you and your family, what if you're aging into Medicare, and how to protect yourself from billing errors and Medicare fraud. We're also going to learn about accountable care organizations and how they benefit you. Millennium Physician Group is the largest independent physician group in Florida with over 150 offices in the state. We have primary care offices in 5 counties in Northeast Florida with over 40 providers to care for you. You can go to millenniumphysician.com to find a location near you. Join us right now for a healthcare journey as we work together to achieve the best health outcome for you. I'm Michelle McCormick. Well, welcome to Insurance 101 with Andy Standsfield. Andy is the founder and lead agent for Standsfield Health and Life and is all about helping people to understand insurance while making the best decisions for you and your specific situation in life. Welcome, Andy.
Thank you. Hey, Michelle. How's it
so
going?
glad you're here because I am desperate need of Insurance 101.
Gotcha.
So I'm that person that I have insurance through work, and I use it when I go do my yearly appointments, and that's all I ever really think about it. And last year with COVID, on top of being sick, with COVID, I had knee surgery and my daughter had surgery and all this happened. And I don't think we still met our deductible. So I think we're in that really high range. So give us a little bit of, Insurance 101.
Sure.
Yeah.
Sure.
Tell us about health insurance.
Yeah. Well, to start at the most basic, you're gonna fit one of 3 categories if you have health insurance here in the United States. You either have coverage through an employer, like what you were talking about there. You have coverage if you're on Medicare. So that would be people typically 65 years and older. There's a couple other scenarios where you can be on Medicare, or you are insured outside of an employer. So like maybe you're a self-employed person and you have to find coverage through a private company out there or through something called the Health Insurance Marketplace, which is a government-backed form of health insurance offered by private insurers out there. So it's kind of like almost a Medicare, but almost a private plan, but it's right there. So it's basically for people that just don't have coverage through a job. It's just the easiest way.
Yeah, like for freelancers maybe, correct, or contract labor people. Okay, all right, makes sense. So, when does healthcare, it's so complicated and it's so confusing. When does healthcare as an adult really start to, like when you start to have a family, when do you start to see people really get into the weeds with healthcare? Yeah.
Starting a family usually does it. Pregnancy certainly will kind of bring about, I got to do something about it. Or even planning for pregnancy. A lot of people I've talked to, especially on the younger side of the crowd, health insurance becomes really, really important when they start thinking about having that first child, and then all of a sudden it's, what is this all about? I had something through work, or maybe I want to start a business or something. There's all sorts of random questions that come up, but usually that's a good trigger. Either that or an accident or something, or an experience in the hospital, or an experience with a parent or a grandparent like that, just seeing what they're going through. So well,
and in your 50s, do you need, once you age out of kids, and you're moving into your 50s, your golden years, before golden years, pre-golden years.
Absolutely.
Yeah. Let's touch on that. Do you need supplemental coverage, and what sort of budget does that require?
Right. So still talking about insurance coverage all the way up until age 65. So 65, you're going to be on Medicare, which is kind of it's different. It's set up differently than it is for health insurance for anybody younger than that, or people that are not Medicare eligible is what they say. See, when you say supplemental insurance, basically you're going to have a health insurance plan of some kind, either through the marketplace, either through an employer or something like that. And typically that pays for a certain percentage of most medical services. And there's not really much of a supplemental type thing there outside of like a plan. In case you go to the hospital and you have a high hospital bill, you can have what they consider ancillary or supplemental insurance policy, which basically the duck is a big one right there. There's a couple other ancillary insurance providers out there. Basically, they're just going to say, well, here's a chunk of money if something happened to you that goes along with what our policy says. You got in the hospital, you were in some sort of accident. And that basically pays you a chunk of money in order to pay the hospital or the doctor bill, or sometimes do whatever else you want with that money as well. That's about the only real ancillary or supplemental thing you can have before going to Medicare.
Okay. So, but what about that deductible? You know, how do you reach, a plan is, and correct me if I'm wrong, a plan is cheaper if you choose a higher deductible?
Typically, yes. Yeah. A deductible, just like a car insurance deductible, if you have a $500 deductible on your car and you wreck your car, you pay the first $500, the insurance company pays the rest. The same thing's going to happen in the health insurance side. And yes, typically you're going to find that the higher the deductible is, the lower the monthly premium will be.
Okay.
Typically.
All right. Yeah, typically. Yeah. I mean, because like for a family of 5, for example, and you're paying $600-800 every pay period, perhaps in some plans, you choose that lowest, monthly payment but that makes your deductible much more difficult to reach. Right. And what happens when you reach that deductible?
Yeah. So when you reach the deductible, it of course is according to whatever the plan says. But typically, by the time you reach the end of when you reach that deductible, then services that you get anytime after completing that deductible will be subsidized by the insurance company. Sometimes it's 60%, sometimes it's 70, 80, sometimes it's a full amount. It just depends on what that particular plan says. But you're basically not coming out of pocket full amount for whatever services you're getting after you've met that deductible. So.
Our conversation is with Andy Standsfield with Standsfield Health and Life, and we're learning a lot about insurance right now. So in your late 50s, is this when you should start looking for a new primary care doctor if they don't accept Medicare? When do you start talking to your doctor about Medicare?
Okay, sure. So, again, with Medicare, you're looking more around age 65. That's usually when people, right around the time you get to about 65. Don't worry, plenty of insurance companies are going to know that you're turning 65. You're going to get slews of mail and things like that. So you're going to know when it's kind of time. But basically, you have 3 months prior to your birth month of the age 65. So when we're in our late 50s, we're still kind of stuck there for another few more years, unfortunately. And I say unfortunately because most people find that the pricing for services when you're on Medicare is significantly better than what you're dealing with in your late 50s, early 60s. Kind of a quick aside, I usually say if people are looking to retire early, maybe getting to 62, I can collect some Social Security, that'll supplement some income here and there. All of a sudden you go and you see what it costs to insure yourself outside of an employer health-wise at age 62, and then you think, wow, there goes any supplement I might have had from Social Security right there.
I think you're right on, because I think that will deter some folks from early retirement, because how am I going to insure myself and my wife even at that point until I get to that big 65? And if the wife or the other spouse is even younger than that, you're still looking at a few more years.
It's so true. So true. I've run into many, many people in that situation, and I hate being the bad guy to bring that news to them, but it is what it is at this point. But when you do get to Medicare, when you do get to that time, like I said, the first thing you're going to want to do is look at your situation. So are you going to be completely retired, not working at all? Are you still going to be working a job when you turn 65? Those things will affect what you elect to do with your Medicare at that point in time. But basically, say a scenario where you're going to be retired age 65. You actually have 3 months prior to that birth month. So say you turn 65 in May.
Yeah, so 64.7
right,
is that magical age.
Right, yeah. And you basically, this gives you the ability to go on to Medicare.gov and just elect to have Medicare start on the 65th birth month. So like I said, if you turn 65 in May, you can sign up right now, actually, and then you wait for a card in the mail. You get your Medicare card in the mail, and it will say that you are starting your Medicare Part A May 1st.
Okay, and what is Part A encompass?
Correct. Yes, so for most Americans that have worked and paid Medicare taxes in their paycheck at least 10 years of their lives, they get Part A, which basically Part A is just an insurance plan subsidized by the government that helps pay for hospitalizations. I like to think about it like overnight type stays in places. If you have an overnight stay, you're typically in a hospital somewhere, almost like paying for room and board. So all hospital services and nursing that comes in, meals, things like that are paid for by Part A. essentially the hospital just sends the bill to Part A of Medicare. So if you worked for 10 years, you paid your Medicare taxes, there is no cost to you for that portion. But that doesn't count for doctor visits and things you do during the same day. So like an x-rays or MRIs, most of the stuff that people think about when they think of using medical services, that's usually outside of the hospital. In that case, you need to have what's called Part B of Medicare. So when you look at your Medicare card, if you see a Medicare card, you'll have your special code number there, your Medicare number. Underneath it, it'll have Part A, and it'll have an effective date of whenever that starts. In our situation, we're saying May 1st.
Okay.
If you would like to get Part B, you have to elect to have that, and everybody is assigned a monthly premium for that. In 2021, typically that premium is $148.50 a month.
Okay.
If you make a lot more in your previous tax returns, I think in the 200s, then they will tack on an extra amount just for you to have the same Part B services that people get for $148, except you'll be basically hit up a little bit more from that. But the Part B is there to cover all what I call same day visits, your doctor visits, your x-rays, your imaging, your labs, things like that.
And Andy, there's a lot of folk that at that age that have pre-existing conditions. So is there anyone who shouldn't enroll in Part B?
No. So the good thing about Medicare, actually any government subsidized type insurance, they don't really worry about pre-existing conditions. It's a guaranteed acceptance right there. Okay. So I always suggest, yes, if you're going to be in that scenario, you want to be looking heavily at enrolling in the Part B of Medicare, because outside of that, you're going to find a very difficult time finding coverage that is anywhere near close to what Part B would offer. I've come across one or two, but usually they wind up coming back to it and saying, no, I really do. Part B is a better deal for me. I'm going to go do that. The trick there is that if you don't do that within your window of time to enroll in Part B when you first should, when you turn 65, then you may have to have about a 6-month waiting period in order to get to start Medicare Part B later on, and you may pay a penalty on top of that. So it's heavily encouraged. Yeah. Heavily encouraged to get your Medicare Part B started at 65.
Andy Standsfield with Standsfield Health and Life, helping us through our Insurance 101 conversation. Here's a great question that I received from a friend of mine when they heard I was doing this. This was a great question. If you're working when you're eligible at age 65, do you need Part B if your employer still provides your health insurance?
Yeah, it's a great question. The answer is no. You do not have to be on Part B. I always suggest, though, you look at what your company offers in the health insurance benefits and then what you would get looking at your Medicare benefits and any other additional things you can put on top of your Medicare and see which is a better scenario for you specifically, not just for anybody out there, but everybody has their own needs for healthcare and they have all their own things going on. It's certainly worth just seeing which might be a better deal down the road. In the past, I would say employer plans are so much better and all that, but it's not quite like that anymore. So it's definitely worth a look just to see which would be better for you.
Well, it does mean a lot of research, and that's what you do. You help people kind of cut through the minutia, if you will, of the insurance, because there's many different companies, there's many different plans, there's many different options. What is SilverScript?
Okay, yeah. So remember we talked about Part A and Part B. That basically handles a lot of your medical services. But what happens when you're prescribed a medication?
Okay.
That has nothing to do with Part A and Part B. That is medical services only. That is not the drugs that you're taking, the medications that you're taking. So SilverScript is what's considered a Part D plan. So we got the D of the ABCDs of Medicare in there. It is called a prescription drug plan. SilverScript is actually just a company that offers a prescription drug plan. It's one of many, many companies out there that offer prescription drug plans. And really all you do in that scenario is you take a look at the medications you're taking right now or medications you will be taking soon enough. And then we go ahead and we look at all the different prescription drug quote-unquote Part D plans that are out there. SilverScript is one of those options. Okay. And just see which company offers your particular medications at the best possible price. And that's kind of the idea there. And that can change every year, which is why you have an opportunity to change your things at least once a year. if not more in some cases.
So when is that? So the enrollment is usually like October 15th to like December 15th. Is that usually?
Yeah, it's October 15th to December 7th when we're talking about Medicare. And
Okay.
not to be confused with an open enrollment period for people underneath 65 who are not covered by Medicare, which happens around the same time. But
It can be very confusing. And then when can you, I know there's a period also that you can make a change.
Yes. Yeah, so we're actually in that period right now that's called the Medicare Advantage Open Enrollment Period. So this is not a time for everybody to change, but there is a certain arrangement that you can have when you're eligible for Medicare where you have a plan called a Medicare Advantage plan. Medicare Advantage plan sort of combines all the things that Part A would do, Part B would do, and a lot of times what Part D would do, kind of all in one package. It feels to a lot of people a lot like their old employer plan that they had. Where, I have this plan and I pay co-pays when I go see my doctor and things like that. But for people in that scenario with a Medicare Advantage plan, this time of year from January 1st to the 31st of March, if you would like to change from a Medicare Advantage plan from one particular company or another, and you want to switch to another Medicare Advantage plan from another particular company or another, you have the opportunity to do that one time only. If you made that choice today in March, then the 1st of April will come along and you'd be on that new plan. And the next opportunity typically to change that, unless you have some special exceptions, would be October 15th, later in the year.
Okay. Well, Andy, thank you so much for kind of making it a lot easier to understand. Sure. Andy Standsfield with Standsfield Health and Life. Coming up, Andy will help us wrap up our healthcare journey today. We're going to give you the top 3 takeaways from our conversation. So stick around to hear those top 3. The conversation will continue. I'm Michelle McCormick, and our conversation today has been all about insurance. Well, welcome to Insurance 101 with Andy Standsfield. Andy is the founder and lead agent for Standsfield Health and Life and is all about helping people to understand insurance while making the best decisions for you and your specific situation in life. Andy, we kind of covered a bunch of stuff in that last segment, from Medicare to when you first join health insurance plans with your work and pregnancy. But, what are the top 3 takeaways we can leave with today? Sure.
So I think above all, most of the time people ask me, well, what's the best insurance plan out there? What's the best thing for me? And that's really that is something we figure out together. Everybody has different needs and different desires and different doctors, different
budgets.
Yeah, all kinds of different things. Just know that there's probably an option out there for you. It may not be the best for your neighbor or your friend at school or your friend at church or anything, but it is going to be a very good scenario for you and your needs. So,
and you probably know stuff that's way down that no one might not have ever heard of.
Yep, exactly. The part of my job that I like the most is just the conversation I have with people about their particular situation. Usually throughout that conversation, we really work as a team to figure out what is going to be the best bet moving forward on an insurance plan. That's really the part that I like about kind of piecing that puzzle together.
Because nobody wants to having to keep redo insurance. I'm telling you, once you find that plan, stick with it.
My goal is to find the one that works the best.
Right. And so that's a great takeaway. Another one we were just discussing maybe about the coverage. What am I covered for?
Exactly. And that's a question I get all the time too. Oh, is this covered, or is this other thing covered? Is this one service covered? And I think it's really important for people. It's a simple kind of play on words, but coverage does not mean fully paid for. So just because an insurance plan says that they will cover a particular service, like a knee surgery of some kind, it doesn't necessarily mean they're going to pay for the whole thing. So please don't get caught in the trap of thinking, oh, that's covered by my insurance, and thinking you're not going to have anything, any skin in the game.
Yeah, because that's a disappointing bill when you get it.
Yeah, it is. And so just having the expectation up front just eliminates a lot of disappointment there in the end.
Well, and coverage is, like you were saying earlier, it could be 50%, it could be, 10%, the range is varies.
It is. It's all over the place. So don't just stick with, it's covered.
Right.
Because you don't really know exactly what that means.
Right.
Case.
So number 3 of our takeaway today could be, there's still an opportunity to make a switch if you're with Medicare Advantage.
Correct.
We just talked about that, but what else is happening right now?
Yeah, if you haven't seen on TV or anything, YouTube or whatever ads out there, the the health insurance marketplace. Some people call it healthcare.gov online. This is insurance that is for people that are not covered by a job out there. Usually you have a chance to enroll that in the end of the year, every year between the 1st of November and the 15th of December. They have opened up a new enrollment period this year only. A lot of reasons backed by COVID, people losing jobs, all sorts of things changing in the past year, where if somebody is stuck without insurance and thinking they have to wait till the end of the year to get it, these would be people that are below 65, not quite on Medicare and not part of employer coverage.
Right, and this is Obamacare or the Affordable Care Act.
Yep,
right?
Exactly. Obamacare, Affordable Care Act, the marketplace. There's a million words for the same thing. But essentially, we have they've opened up this time period between the 15th of February and the 15th of May this year. So right now, you have the ability to go online or talk to somebody like myself or another agent that can specialize in this and find an insurance plan to start basically the first of the following month. So you're not stuck the whole year without any kind of coverage.
Right. And some coverage. Yeah. But I think that's very important for folks to know that, it's still very vital that you have some sort of health insurance, especially with the illnesses going around. I think it's very important for my kids and everybody to be covered. What do you tell people who are kind of on the fence about getting health care?
Yeah, great question there, because I have had a lot of people that say, well, I can just go without it or whatever. And then, the big insurance question is the what if question. So if there's anything to be said about even the healthiest person out there needs to have some sort of health insurance plan there, because what we're looking for, you'll find that all of these plans now have what's called a maximum out of pocket. This would be the most amount of money you could spend personally out of your pocket, not monthly premiums not included in that, but on services. And if you reach that certain amount during the end of the year or before the end of the year, the rest of services beyond that are paid for. So this is essentially like your safety net. I always say to people, well, okay, if it's an $8,000 maximum out of pocket, that sounds really high, but a hospital bill for a few weeks might be $80,000. And that's really kind of the crux of it. There's really the most important part is making sure you have some sort of safety net built up against catastrophic loss when it comes to health insurance.
I agree. Well, Andy Standsfield with Standsfield Health and Life was my guest today, and thank you so much. How can we get in touch with you, Andy?
Sure. Well, I'm here in the area, but you can reach me on my cell phone, 904-504-3782. Or by all means, go visit my website and ask questions on there as well. My website is www.stansfieldhealthandlife.com, all spelled out. Standsfield Health and Life.
Well, thank you, Andy, for coming in and educating us a little bit on health insurance. It is quite a topic we could spend a lot more time on, Definitely. I am sure. Your healthcare journey is important to us, and our goal at Millennium Physician Group is to work together to achieve the best health outcome for you, and that starts with seeing your primary care provider. In good health, I'm Michelle McCormick. So long for now.
Millennium Physician Group's Medicare Connect program conquers the confusion of choosing the right Medicare coverage for you. Be confident in your Medicare choices. Millennium's Medicare Connect gets you started in the right direction. Connect with us today at Medicare Connect at mpgus.com. That's Medicare Connect at mpgus.com.